Hello, and welcome to the Unsung Cyberhero Adventures TV network. Today's show focuses on answering the question, what are the strengths and weaknesses of today's healthcare ecosystem, and what should the multitude of stakeholders be doing right now to maximize their security posture in a COVID-19 digital universe? Stay tuned to find out. I'm your host, Gary Berman. Our mission is to shine the light on the people and organizations who keep us safe online while at work, home, and school, and to serve as a business-to-business networking platform for the cybersecurity and IT communities. We've learned that 55% of human communications is nonverbal. That's why we include a video feed so that you have the option of seeing our guests or simply to just listen. It's also why we're called a TV network. We're all about information sharing and business-to-business networking because you'll never know who you're going to connect with and how you'll be able to maximize opportunities resulting from hearing from our guests. This is especially valuable right now that the community's primary way of conducting business, conferences, has been put on hold for the foreseeable future. Our first guest is Joseph Davis, the Chief Security Advisor at Microsoft for U.S. Health and Life Sciences, where he advises payers, providers, pharmaceuticals, lab sciences, medical devices, and various research organizations. Prior to Microsoft, Joseph led North America's security advisory for Avanade and Accenture. He spent over a decade at Covidien, now Medtronic, building their information and security practices, including traditional IT security, SOC, incident response and forensics, security architecture, identity and access management, enterprise IT risk, IT compliance, and data privacy. As if that was not enough, he also built a world-class global security operations center. Hey, Joseph, thanks so much for joining us today.
Thank you for having me.
Our next guest is Nina Alley. For the past 5 years, Nina has served as the executive director of the biohacking village at DEF CON, overseeing the phenomenal growth of the device lab, speaker track, and hands-on lab. Prior to that, Nina spent 16 years in healthcare, building, breaking, securing electronic medical records, connected medical IoT devices, and working in the citizens science area of microfluidics. Hi, Nina. Welcome to the
Hi,
show.
thanks.
Well, Nina, as you know, my brain lives in the superhero world as the creator of the cyberhero adventures, Defenders of the Digital Universe. So I'll use a superhero trope and ask you, what is your origin story?
I thought you were gonna ask which superhero I wanted to be, and I was like, I don't know. My super, my origin story is that I served in the Marine Corps for a while, did stuff and things, got out, needed a job, and this was when electronic medical records were just starting to become a thing, and I went in with I went in to a ambulatory center that had 22 facilities, and I think it was like 25 different specialties, services, and got them from working from paper all the way to completely being on the electronic medical record. And then I've worked in various hospitals of New York City doing the same thing.
Wow. Well, you are precisely an example, a real life unsung cyber hero who kind of toil in anonymity to keep us safe. And we're on behalf of the digital universe, thanks so much for what you do. I mean, what is it about healthcare that really just caused you to be so passionate?
I think it's the ecosystem itself, how there's so much to know, and it's disparate information bases. So everybody knows a little bit about something, but not everybody knows everything about all of it. And that part of healthcare really bothers me because it's such a lack of communication and lack of literacy between the different parts that, especially now with COVID and all the other things that are going on currently, healthcare is kind of suffering because they don't know what they don't know. And that becomes a problem with how you're securing the IT, the IS, the parts and the pieces and the people.
Yeah, for sure. So, Joseph, thanks so much for what you do as well. I mean, you've been a pioneer, in this field, and so tell us your origin story.
Oh, my origin story starts with boredom and curiosity. So I was, as a young kid, I guess of 8, 9, 10 years old, I was incredibly interested in how the telephone network worked. So I got involved with exploring the telephone network back when it was Ma Bell and AT&T and 9X and all those companies. And then later, I got my hands on part of a computer and built my own. And then I took a different direction. I went into medicine in college med school years, and really didn't get a lot of time to mess around with computers and networks at that time. Decided that's not what I wanted to do when I came out on the other end of it, and miraculously got a job at IBM supporting OS2 and AIX up in Burlington, Vermont.
Joseph, forgive the interruption, but you just kind of glossed over something that I think is incredibly unique. When you said you got into medicine, what does that mean? Were you going to become a doctor, or?
Yeah, so I went to the University of Vermont College of Medicine, and I practiced medicine at a rural medical practice, family medicine, in the middle of a small town in Vermont. Well, it used to be a small town anyway, called Brandon, Vermont. And pretty much at that time, it was 50 miles away from the nearest hospital. So we would see all types of cases, from cancer treatment to cardiac to deliveries. So anything you can imagine.
And did you work in the ER, the emergency room, or were you more of a general practitioner?
So before, no, I did not. So before I was in medical school, I spent 4 years as a student health aide at Seton Hall University. And then at the very same time, I worked in St. Barnabas Medical Center's radiology department. At nights and in mornings, I was a operating room tech, or OR technician. So that's really where I got my hands dirty before I even got into medical school.
Yeah, I mean, so what makes you particularly unique and qualified is you kind of, have both sides of the healthcare cybersecurity, equation since you worked in it. How did you then, evolve into cybersecurity? You were saying about a job at IBM.
Well, I was miserable, and thankfully in my medical profession, I was just not happy with how it was going. And my mentor was a psychiatrist, thankfully, and he pretty much sat me on the couch and laid me on the couch and said, "Tell me what you really want to do, because life is not permanent, and you only have a limited number of hours here. So figure out what you really want to do and pursue it." So I decided, I took a month off to try and figure everything out. And I applied to IBM through a temp agency because IBM had a massive plant, if you will, making PowerPC chips and memory chips and everything else up in the Burlington, Vermont area back in the mid to late 90s. And that's where I applied. And somehow I got a phone call at like 7 o'clock in the morning one morning, and it was the entire decision support team at IBM interviewing me, roundtable style, over the phone. This is before the age of Zoom and Teams and Skype and all that good stuff. And apparently I said all the right things and I got hired.
And where did you go after that?
So from IBM, I really didn't want to live in Vermont anymore. So when I left IBM, I went down to Massachusetts, and because of course .com was blowing up, and I worked for a small sensors company called Sensitech, where we would introduce the medical providers and et cetera. We'd put these little puck devices that would beacon out using cellular on pallets of Merck's vaccine, et cetera, so that if during the cold chain transport of these vaccines, anything would go haywire with the temperature, we would be able to pick it up instantly. So we knew who to blame. Because these pallets of vaccines were worth millions of dollars.
And Nina, you were nodding your head. Can you share with our audience, did you have some experience with the nature of the problem that Joseph just described, or
I feel like you and I are twins of some sort, because so I worked at Sloan Kettering Cancer Center in Manhattan, and I was actually going for nursing, and I was doing the programming on the EMRs at the same time. And they said, if you quit nursing, we'll pay for your master's to do informatics. So I quit that, went into informatics instead. But I had the only thing I had to do left was my rotations. So I had everything else done. So I did that, and I also did all the coding. So when people put in their code for symptoms and diagnoses, so I had all of that. So when I would walk around to people and I was doing their clinical notes with them and for them, I'd say, so is this what you're looking for? Because this is only a 3. The end part for your coding is only a 3 at max with this. So let's maximize everything that you can do, figure it out. And then once you code it, it's easier for the folks on the other end to do all of those things. And I have a particular keen interest in cold chain, because if you don't get the cold chain issues right, there's a failure in the system. That means the patient's going to be affected, right? So, and I don't think a lot of people understand or know what exactly cold chain is. And yes, so I'm completely on board with everything you're saying.
Well, what is it?
Twin brother.
Explain to our audience.
So, like you said, it's essentially watching the temperature, the status of the temperature of whether it's a medication or food or whatever the case is for any industrial system, actually, to ensure that it doesn't get contaminated, because once it reaches a certain temperature, you can have bacterial buildup, in which case now you can't use it. Or if you do use it, there could be issues with the patient or whoever is the end user.
And these are, physical devices that just reside within the product, the vaccines?
Early IoT, well, in my experience, I mean, we're talking I took the cold chain job in, I want to say 98. No, it was probably 97. Yeah, it was 97. So back when I first started with the company, the way it would work, it looked like a hockey puck. And it was just basically a circuit board that took measurements of humidity, temperature, vibration. And I think that was about it at the time. And the way it originally worked was the person shipping would have to basically take the readings via serial port. They'd hide it somewhere on the pallet. Let's just say it's a pallet of vaccines. It could be a pallet of fresh seafood, who knows, right? Mm-hmm. But a pallet of vaccines. And then individuals on the other end of the supply chain, meaning it gets on a boat, it gets on a truck, it gets on a train, it gets on a plane. They would have to then plug the device, find the device on the pallet, plug it in, and with a serial cable, if you remember what those are, and basically take all the readings. And they could see, wow, while it was in the trucker turned off his or her air conditioning, and spoilage occurred. Then we got a little more modern at the time and decided to use the analog cellular network at the time, which was somewhat problematic outside of the United States, because of course you had different carriers and different bandwidths and all that good stuff back in the late 90s. So, but it was, it was pretty exciting. But to answer your question, it's a little puck device. I guarantee you today, it's basically RFID. Yeah. About the size.
I worked on something a couple of years ago, maybe 3 or 4 years ago. And I think it was about the size of my, maybe the size of my palm, about half the size of my palm. And
wow.
Yes.
We used to call it a hockey puck.
You're bringing up a number of really important matters. I mean, so Nina, what about the vulnerability that the healthcare ecosystem has with the supply chain? Like Joseph, just mentioned all these steps. I mean, how's all that going in the healthcare system? Is supply chain, and Joseph is laughing, I can see on the other monitor, but how's all that going?
Are we just talking about COVID, or are we talking about in general?
I mean, in general.
So see, I got to sit up now because I'm excited about this. So I have been mind blown about how supply chain has been handled in general, and if not more recently, where just pharmaceuticals, 80% of pharmaceuticals in the United States are produced in China. So now that we have an issue where we need to get something done, we can't just readily go over there and say, hey friend, can you hook us up with something? The rest of the world is looking for the same product. And one of the issues that they're looking at right now that's actually, it's either going to the floor for Congress to decide on, is a bill called, I think it's called Beat China, if I'm correct, and it stands for something. And what they're trying to do is bring back pharmaceutical manufacturing in Puerto Rico, and so that it's more localized, which makes a lot of sense because there are already facilities over there. And then at least we can do the things that we as a country need to do, and we don't have to farm it out the way we
and Puerto Rico, maybe to our audience may seem, like sort of an arbitrary choice, but is it true that Puerto Rico, has a history and infrastructure to manufacture pharmaceuticals?
They're already built. Nobody is using them because I think after Hurricane Maria, they may have been flooded, something happened, and they were not shorn back up. So now they're looking at them going, oh, this is an opportunity. We can fix it and continue to make profit and
Wow.
help patients.
Yeah, for sure. Joseph, so you were shaking your head. You have some, obvious experience in supply chains.
Yeah, beyond the cold chain, it gets really, really interesting around trade secrets and medical devices. So a company I worked for, you mentioned it in the intro. We did everything from respirators to surgical equipment to insulin pumps, you name it. We did it all, feeding tubes and infusion pumps, et cetera. And what we started to see in the industry is a lot of our products started to get counterfeited, right? And our salespeople would see them at industry conferences and those types of things, and come back and tell our executive leadership team, hey, that looked a lot like our product. So that opened up a big can of worms for us, because we got a hold of some of these products, reverse engineered them, and found that some of the code that we thought was proprietary to us, a trade secret, not patent, was actually in these devices. So that means that someone either walked out with that information, or it was obtained through a cyber incident, if you will. Or maybe it was just reverse engineered somehow, but they were definitely coming out of China. So it presents a couple of problems. The first problem is, if that device is ineffective, how do you prove attribution? It's very difficult, right? So how do you track it back to the company of manufacture or the company of design? And we were starting to see attribution back to us for products that we didn't create. The other thing is, how do you ensure quality? You just can't. And then how do you ensure privacy, right? So there could be a computer within a computer, if you will, right? So every time the device takes a measurement, it also sends that measurement off to somebody who's collecting that information that shouldn't be collecting that information, right? Not to get the foil hats out or anything, but these are the things you encounter in that world.
Yeah, wow, that's incredibly interesting. I had the privilege of recently interviewing Kevin Tierney. He's the VP of Global Cybersecurity for General Motors. And, one of the reasons I thought that'd be a super cool discussion to have is they made this massive pivot to start to create, ventilators, and they did it in a very, very short time, a matter of weeks. They had a team that was able to learn all about it, and it must have been terabytes of code, to try to manufacture something like that. Nina, is this would that be an example, like how quickly and how well General Motors did this? I mean, is this what we as the healthcare ecosystem need to be thinking and acting, like with this sense of okay, we can get this
Urgency?
done? Yeah, Nina.
So I want them to act with a sense of urgency. So while you were talking, I was writing. A lot of the problem with the medical device community, or just the medical community in general, is there's not a lot of conversations about stuff, because they hold on to the protocol secrets, or whatever sort of secret it is. And my issue with that is constantly and always, there's a person at the end of this. No matter what happens, there is still a human that is going to be affected. To your point, I'm approximating because I can't remember exactly. I think it's 32 days before people know that there's somebody in your system. So they've already been sniffing around, taking small steps into everything that you own and just pulling things. And with the current situation that we're in, I've been on phone calls with some of the medical device manufacturers, and they're pulling their hair out because they're like, our servers are getting destroyed. Our SOC is exhausted. Everybody here is just going crazy. I totally get that. But this just further goes to prove the point that we need to secure more of what we're doing. It's not the situation of nobody wants to hurt a patient. Correct. Nobody in healthcare wants to hurt a patient. But now that we've made all of the information digital, now it's all information and it's all up for grabs. So we need to be more careful with how we're maneuvering through all of that.
Yeah,
And
for sure.
just as another sidebar to add to what you said, there were R&D servers, research and development servers. I don't remember where, but I think it was 2 to 3 different academic universities that they just had all their information pulled. I'm not sure if it was just copied or it was just completely grabbed, but the universities had to put out the information that they got owned. All their information was gone. And then suddenly things that they had worked on were in papers, and there were devices being brought out of this. And they were like, but we did that. How did this even come about? And it's, again, if it's medical stuff, it's super important. These are cash cows. So there's a need, there's a want to take the information and produce.
And just one thing I want to interject, and this is not sour grapes for my career or anything like that, but I remember ringing the alarm bell well before the salespeople would come back from these conferences saying, "Hey, our stuff is being duplicated and counterfeited." I used to go to the executive committees meetings and say, "Hey, this is going to be a problem," and they said, "No, it's not. We're not a bank. We're not the government. No one wants what we have." And I can't tell you how many times I heard that between, I don't know, 1999 and probably around 2007 when all the shenanigans started happening with nation states trying to quote unquote steal, if you will, trade secrets. And you're right, there is a patient on the end of it. And that's a whole separate, medical ethics conversation that we can have. But I had to act within the bounds and the borders of the way corporate America tends to hold on to trade secrets.
So if we're going to talk about that, then so Hippocratic Oath, right? That's primarily and only for medical physicians. When you get your white coat, it's like your patient first, last, and always. Amazing.
Right.
So I'm the Cavalry is another organization that does a lot of healthcare work and medical design stuff, medical security stuff. And a couple of the folks from there came up with the Hippocratic Oath for medical device manufacturers, and a couple of them took it, and that's fantastic. Right. But here's the thing, because I've worked in hospitals for so long, I'm like, that's cool that the medical device manufacturers taking that. And I understand that they collect the data, but it's the hospital that ends up using it. So where's the Hippocratic Oath for these hospitals? Because they are the repositories for these things. So we need to instantiate something like that. So the information's not just like, we got it, it's in our servers, like, cool, but are you protecting it? Because the same way that the patient you have to protect, that information is the patient.
And I agree with everything you said. I just want to throw two other issues out on the table. The first being what I'd like to call, at least we were calling that back when I was working with MDIS, what we call the legacy problem, right? So if you look at all the medical devices that have been connected medical devices, whether that's connected via serial port, Ethernet, Bluetooth, Wi-Fi, or IR, it doesn't matter, right? So those have been proliferating the market since the early 2000s, right? So we have all these devices in the marketplace that haven't gone through fuzz testing, haven't gone through any kind of security white box, black box testing, et cetera. And so how do we secure those devices? Because they're not going anywhere. And now with the constraint of all kinds of clinical and hospital budgets, they're not running around replacing their devices unless, of course, those devices are completely.
So I'm doing this for you right now, yeah, because I harp on this so much.
Yeah.
Everybody is working on, let's do all these roadmaps for all of these new things that we're building on. And it's like, cool, but you have a whole bunch of other things that you need to be looking at.
Right.
And more than that, how is everything integrating? Just as a sidebar, I had a conversation recently, I think it was last October, with someone that said, we're not online at all. Our patient data doesn't go anywhere. And I was like, well, then how are you getting that information from this product to the physician? And they were like, Bluetooth. And I was like, that is, oh my God, guys. Oh my God. And I know his boss. So I called not like you did wrong. I called his boss and I was like, hey, do you have the PDFs? Can I see your PDFs? I'm just wondering about what it looks like. And he sent them over to me. And I was like, yeah, you may need to have more intense and deeper conversations with the research folks on your side so that they know what's going on, so that they can protect all of these things correctly. And more than that, so that they can document them.
Absolutely. So, Microsoft is looking at trying to help with at least the legacy IoT, not, and more specifically the legacy connected medical device issue by looking at, different network paradigms and gateways and, basically gateways that talk back to the Azure Sphere Cloud.
Is there an advisory board for this? Can we be real friends in real life?
Yeah, let's be real. Let's take that offline because there are so many of them. I'll get you in touch with Dr. Dale Norberg and some of the other folks I've been working with over the years.
One of my platforms for coming here today was, so how are you guys helping the medical device companies and or hospitals and or EMRs or just the medical ecosystem at all that are working on or with Microsoft? How are you guys helping them reach that next area? Because they're still on XP, they're still on all these legacy systems that have 0% patches, and they're just like, it works and we can't change anything. It's good enough.
It's scary. I had a very close personal friend of mine works at a very large and very well-respected hospital in the Boston area. And he had told me before he left his role there that they were recycling medical devices that they knew had WannaCry on them, and they couldn't remove the WannaCry. So what would happen is, they'd roll it into a patient, a patient's room. They would hook it up. It would work for so long, and then it would stop working, and then just roll another one in. And they were so afraid of making changes to that device because it would either brick the device or they'd be violating some sort of high-tech rule. Yes. This is a very interesting problem, and I don't think our clinicians have been as transparent, or at least the clinicians that manage IT haven't been as transparent as they need to be about the problem.
So let's layer this, because why not? When Hurricane Sandy came into New York, NYU had all of their servers were in the basement. And when Hurricane Sandy came, it flooded everything out. So they had to move out a bunch of patients. So a lot of the patients came over to Sloan. And that was one of those moments of, what are we doing, guys? We have to, there's a lot of issues, right? We're always going to have a lot of issues. But we have to do a little bit of knowledge balancing to see how can we fix what we have now. And I'm a big fan of workflows. I'm a big fan of threat models. And those are things that we don't do. So the reason I brought up Hurricane Sandy was because they were not prepared for an evacuation of a hospital. And I believe that was one of the first times, if ever, that they had to do it. And NYU is a massive hospital. And just imagine all the ambulances they need, the stretchers, et cetera, and bringing the folks over with whatever they were connected to, and then putting those things onto somebody else's network.
Sorry, Joseph, but just to make this even more complicated, I understand in the last few days, there was an announcement that, one of the foundations of code of the stack of almost all IoT devices, like 1 billion IoT devices, had vulnerabilities in it. Have you heard about this yet, Joseph? You're nodding your head.
Well, yeah, I haven't dug into it, but I have heard about it. Yeah, it's based on, a lot of it's based on hardware. There's software encoded in the hardware. We used to call them ASICs. Those chips that have a specific function on the board that either modulate frequency or something like that, and it's like Spectre and Meltdown, as far as I can tell.
Is this different than Urgent 11?
No, I'll put it in the show notes.
Okay.
But it was incredibly interesting and eye-opening. It was reported just in the last couple of days. But I'll have that in the show notes. Nina, one of the things that you mentioned a little bit earlier was the reluctance of folks within the healthcare ecosystem to share information. I've come to learn that there's actually one, very large company who, I wouldn't name on the show, that controls something like 60 or 65% of all personal health information. In your role over at, the Biohacking Village, I know you're all about, information sharing. How's it going? Are you getting the ecosystem, especially right now, to kind of play nice with one another?
So before all of the things happened, some of the medical device manufacturers were talking about getting together and working on projects together because that's logical. And now I think it's more about protecting self because the resources are so limited and everybody is trying to just make sure that it at least works. I find that from conversations with some of the people that I keep in contact with, they're like, I don't even know if it matters so much about security. It's just at this point, keeping the patient alive. That's what we're focused on. Right. And I totally understand that. I get that. But this is also the time where we need to maybe not sit because there's not enough time for that, but at least have a running dialogue and a living document where we can start reimagining and reinventing how healthcare is going to work. Because what we learn now is going to have to push everything forward. We can't just go back to like, oh, it's fine, because it's not fine.
Yeah, for sure. And you know, maybe you can share with our audience your recent decision, you know, at DEF CON and Biohacking Village, you know, to be virtual. And, you know, can you share with us the deliberations, you know, of that incredibly complicated question? And what are your plans for this year?
Way to be subtle. So how did the decision, so when we were building out this year, we were doing two things at once. We were building it virtually and we were building it out for in person, in real life, because we weren't sure what DEF CON was going to do. And we also weren't sure what we were going to do, because as the only biosec village at DEF CON, that's a lot on us too, because of our audience. So before DEF CON had announced that they were going to go virtual, we had decided we were going to go virtual regardless, just for human safety issues. So now we are going to do, how many details do you want?
I think the audience would be very interested in this.
Me too, because it's still in play. So we're going to have, it's either 3 or 4 days of talks. We're merging the workshops and the talks. So 8 hours of that recorded, and then we're gonna loop it so people can hear everything over and over again. And we're also going to archive those on our YouTube page. And we are working on the device lab and the CTF in tandem. A lot of folks are afraid, and rationally so, the medical device manufacturers, because of how people would have to function for the medical devices, as far as like, we may have to get them into your walls. So we may end up just doing a CTF with a bunch of flags for everybody. So that's still something that we're working at. We have about a month, so, you know, fun.
Yeah, because you know, you work on an accelerated pace, but a month, you know, doesn't sound like too much to me. But Joseph, what about Microsoft? You know, what did you have plans for DEF CON or other conferences? And you know, our audience can see in your background that you have, you know, a conference virtual reality photo up there. I mean, how is the Microsoft in the healthcare practice evolving now, and what are your plans?
Well, as far as conferences go, they're more general, right? So coming up, we have Inspire, which is our partner conference, and these usually take place at the same time in Las Vegas in July. So it usually overlaps with DEF CON, or it's like right before, right after DEF CON. But now that we're doing all these things virtually, they're going to be somewhere in the late July timeframe, rather than, you know, kind of the early July timeframe. But so we have, like I said, Inspire, and then we have Ignite, which is basically our big bash, where everyone's invited, you know, partners, customers, etc. These are going to be done virtually, and it's probably going to be 2 days instead of a week. You know, I was just signing up for them this morning. As far as within the healthcare realm, we attend HIMSS, we attend HISAC. We're usually sponsors, you know, as vendors, etc. Our focus is not as strong in the med device area, although I have gotten a lot of queries from my customers around how can we go ahead and secure med devices that we're creating, connected med devices, etc. Can we leverage any of the Azure Sphere, or Azure IoT type technologies? But the real focus has been really on the back office, electronic medical records, modern workplace, and those types of things. So, you know, we're constantly talking about how are you even doing work from home? You know, how's your administrative staff doing work from home with there's a provision in HIPAA or high-tech domain 8, you know, can you split tunnel? What's the user experience like? You know, split tunnel over VPN. Those are the types of challenges. And then these massive ransomware and phishing campaigns that are going on against healthcare providers in the age of COVID. How you know, we're basically trying to help our customers with preventing that, detecting it, preventing it, and recovering from it within minutes if it does happen.
How can
How's
people
that
reach out
going?
to you?
You know, sorry, Nina, go ahead.
No, same question. How can people reach out to you? How is that going? Is there
Oh,
publications?
it's actually
Can we see
going really
results?
well. And I always talk about customers getting religion because I'm not so much, like rah Microsoft technologies, although that's what I'm paid to do. It's let's adopt the modern workplace because I feel it is more secure because what you're doing with zero trust versus the old way of securing your devices, your data, and your identity. With zero trust, you're securing identity and devices and sometimes applications if you can't basically control the devices, meaning you're collaborating with another team outside of your realm of control. You're basically focused on identity. Are you who you say you are? And based on your disposition, based on your behavior, what resources do you gain access to? Do you gain access to no resources, a limited set of resources, or all the resources you're used to gaining access to? So I always use the impossible traveler concept where it's like, I've never been in this location before. I have to really verify that I am who I say I am through multi-factor authentication and maybe other means, maybe device signature and that kind of thing, before I'm going to gain access to anything confidential at Microsoft, right? So it's a much better and flexible model than having to hairpin all the traffic back to some massive security stack at some corporate headquarters for a healthcare provider or for R&D organization, et cetera, and then have to have that awful user experience of, hey, I'm in Japan right now, but I gotta fire up my VPN and connect back to Cleveland, Ohio, in order to access any of my applications and data.
I love everything you're saying about zero trust. So what I work in is emerging threats and emerging tech. And this was one of the things that I was looking at. And also because you brought up the cloud and Asia, telehealth, how can we bring up better infrastructure? So instead of your 50-mile to the next bigger city, we can do a telehealth visit and get people to at least okay before they have to go to a hospital.
Well, there are so many incredible topics that we can continue this discussion on forever, and I hope that we do because the work that you're doing saves lives. And one of the questions I was going to ask is really quite naive, which is, why is the healthcare ecosystem so vulnerable? But let me ask you that, Nina. Why is the healthcare ecosystem so vulnerable to attacks like WannaCry, ransomware? What's up with that?
Like we talked about before, there's just a lot of unsecure and insecure things. The hospital moves around so much. The items in the hospital move around so much. There's no real way to find everything when you need them. And there's no way to document everything about where they are and where they live. And that's one of the problems that we have with this. Everything needs to be secure once it comes into the hospital. And the hospital needs to know that they also need to secure it within the walls of the hospital. It's not just, well, they did enough, now it's here. It's still, you wouldn't do that in your own home. You wouldn't bring something random in and not secure it.
Well, Nina, as we're wrapping up, is there anything else you'd like to share with our audience that will amplify your mission or let them know about what you're going to be doing at the Biohacking Village?
I think this year is going to be new and exciting, and we'll figure out how to do it together, much like how we secure healthcare. It's going to be a lesson for everybody. It's going to be great.
Cool. And Joseph, are there any thoughts that you just wanted to share that we haven't touched on yet?
Well, I'll answer the same question you asked Nina, and I think it's really a legacy issue in healthcare, which sometimes healthcare providers and organizations tend to hide behind these very prescriptive regulatory requirements, right? So in some fields, you get these regulations that are very high level. Unfortunately, in healthcare, you get them so in the weeds that it makes it very difficult for them to adopt modern security and compliance quickly. And and then you have the whole question of funding and cost and being able to modernize very quickly. So I think those two factors work against the healthcare industry.
And
Wow.
team. You
Well,
need a team to be able to do it.
Yeah, you need people, process, technology, which all equates to money
Right.
and time.
Well, there's so much more we could listen and learn from. Can I have the two of you back at some other point?
Certainly.
I say yes.
Great, thanks. Well, and to learn more, we'll have their contact information in the show notes. If you would like to be a guest on our show, just send an email to Gary at cyberheroes with an S, comics with an S, .com, and we hope this helps. Thanks a lot.